After the baby is born, the umbilical cord is clamped at both ends, separated from the mother and baby, sterilized, and thereafter the blood is collected in a bag provided with the collection kit. After the blood is drained, the remaining umbilical cord is also collected and placed into the kit. The mother's blood samples are also collected to check for the presence of transmittable diseases. The collection kit is then couriered to the laboratory through a specialized logistics provider. Once the sample is handed to our personalized courier service, the collection kit is shipped by a next immediate flight with special instructions to avoid X-ray scan. The sample is picked up through logistics concierge service immediately on arrival at the airport and delivered safely. As soon as the lab receives the collection kit, the samples are individually checked into our laboratory software and then taken for processing. The stem cells in the blood are extracted by adding a chemical and spun at high speeds to separate the various components. The middle layer contains the stem cells, which are transferred to a special freezing bag. The stem cells from the tissue are extracted by mincing the tissue into smaller portions, liquefied by adding an enzyme, and transferred to special cryovials.
क्या कुछ नहीं करते आप अपने होने वाले बच्चे के लिए? जिंदगी की पाठशाला में दोबारा स्टूडेंट बन जाते हैं। हजारों लाखों में से एक खूबसूरत नाम ढूंढ लाते हैं। पता है, एक और चीज जो आप कर सकते हैं, दीजिए उसे आशीर्वाद लाइफ सेल का। ये पैदा होते ही नाल के स्टेम सेल्स को प्रिजर्व करें, जो जिंदगी में कभी भी कई बीमारियों से लड़ने में मदद कर सकते हैं। लाइफ सेल, आयुष्मान भवा।
So let me just take you across some kind of an ergonomic advice why it is important during pregnancy. So let us just move towards this. So the outline for my topic will be why we are focusing much on ergonomics during pregnancy and the posture, and how to do the activities of daily living, and what all instrumental activities of daily living, like if you are managing with some household kind of activities, so what all things you should manage, how you should manage, and how to manage with your official work. Right now obviously it's a COVID time, so maybe you might not be going to offices, but yes, definitely one after some time you have to manage with your official work. And the last and not the least, I will be just taking you across the technology innovation to correct your posture at this time. So for all mommies, right? So I want to just tell that if we are performing any task, so we should just focus on the tool which we are using at home or anywhere, right? And we should have a good workstation for performing that activity, whatever we are performing, and in good environment we should be in, so that we feel very healthy towards our work, whatever we are performing. So this is one research. It's Sanjo State University research. So what it says is like whenever we are employed in any of the organization, right? So normally we start working at age of 25 after completing our studies and all. So we are into most probably we are into the childbearing age, right? So we should look into our basically the ergonomic patterns, how we are following those ergonomic patterns, so that we don't have different kind of complications like spontaneous abortions, preterm delivery, and low birth weight, or it will lead to a preterm delivery also. So we should just follow this ergonomic advice, which I am just going to deliver you in this talk. So it's very important and you should just listen it very carefully. So why we are just focusing on ergonomics? So first thing is we have to reduce the accidents, right? While performing any activity, the injuries which we might get into because of performing a activity in a wrong posture, right? Right? And we should reduce the ill health due to poor ergonomics and reduce sickness cost also, because if you are not putting a right posture, so your sickness cost will increase. You should increase your performance output if you are just performing the activities in a right ergonomic posture. So our aim is to feel better and work smarter so that our activities are accomplished. So what happens is if you're not performing any of the activities, right? So in a better way, so what are the causes behind these ergonomic injuries which you might get in the pregnancy is the causes behind is like repetitive or prolonged activities which you will do that will lead to an ergonomic injuries while pregnancy. Awkward posture if you are opting for, or extended time we are doing in any of the activities that will lead to ergonomic injury. Then static posture if we are into one posture for a long, so that's why we advise to just move ourselves if we are into a static posture much. And if we are doing any kind of a vibrating kind of activity, either in the kitchen or either in house like vacuuming and also, we should just take breaks in between. Then high and low temperatures for an extended time, we should not make our body to bear up so much, so a high temperature or a low temperature. There should be a balance of the temperatures around us. And we should just work on the forceful exertions also. We should not take much forceful exertions. Now, coming on to why we are just talking about posture, as I think it's a very layman kind of a term. That posture is to maintain your body, to hold your body in a better way. And why we are focusing more on posture during pregnancy? Because it leads to least strain in your back, as Dr. Vinita explained, that yes, your back should be intact. So we should know that what is the right way to handle with your pregnancy and how to manage with a good posture during pregnancy. So this is some kind of an ergonomics areas which we need to focus. Like what happens is, like there are some kind of stress areas where we get some injuries like eye, shoulder, back, neck, elbow, wrist, hand. So hip, knee, any of the areas can get these kind of forceful injuries during pregnancy. So what I can just say is, as our lifestyle is very poor, either we are into a very sedentary kind of lifestyle. So why we are not able to focus? Because we are not focusing on physical fitness, right? So what I should just say, as Dr. Vinita mentioned, you should do certain kind of antenatal exercises when you are entering in this phase of life. So you should focus on your physical fitness, and then you should just obviously have good food habits, a nutritious kind of food habits, and you should do some kind of relaxation which will not lead you to a fatigue kind of in your body. And you not be dehydrated. You should keep enough of your water inside yourself, and you should not be malnutrition. So when we talk about some kind of an ergonomic injuries, when you should just report to a rehabilitation specialist or your doctor, that when you are just feeling some kind of an ache or fatigue and it is just going with some kind of a rest, but it is there that there's some kind of an ache and fatigue while doing some activity, you should definitely report at that time at stage 1. You should not take it to stage 2 or 3, because that will hinder with your sleep. You will not be able to work, you will not be able to balance your home and work together, and it will lead to very stressful life. Now coming on to the activities of daily living, like if you are doing a self-care task for yourself, you should do I think someone is asking some question. um, Dr. Niti, should I yeah so one thing I should just talk about is laying in bed. So what all things you need to focus while laying in bed? So you have to lie on your left side to provide the best blood flow and amount of nutrients to the placenta. First thing to be considered. You should have a correct position. You should bend your knees, place pillow between your knees. An optional pillow, you can just keep it under top arm to decrease that spine twisting. And the fourth thing which you should consider is An optional pillow should be placed under your stomach if you are into the later stages of pregnancy, so that you should feel comfortable enough. As you can just see in the picture above, the red line and the pillow placed accordingly, you can just feel relaxed. Then coming on to the other part is if you will just lie on your back, which is to be avoided, right? So because if you will lie on your back, so it will lead to more of back pain, the circulation will be very low, and it will hamper that circulation and the nutrient level to your placenta also. So, what are the potential effects if you by chance go into a wrong position in your bed while sleeping? So, it will lessen your digestive abilities, it will cause breathing problems, lessen your circulation of blood or blood flow, possibly cause high or low blood pressure. And both of these things are not good for your body at that time. When you are coming out of the bed, right? So, what you need to consider, you have to be at edge of the bed first of all, and once at the edge of the bed you should make sure that you are into a sideline position as you can see in the pictures above, and you can just swing your feet over the edge of the bed slowly and gradually, and next push up with your arms, your body, and push up until you are in a sitting position on the edge of the bed. So this is actually for getting out of the bed, how you will get out of the bed. The reverse is for getting into the bed. You can just follow that. Now, when you are coming onto our bathing tips, you should just use a non-slip bath mat onto the bottom of the tub or a shower floor. So you don't have that slip kind of injuries during pregnancy. You should have a long handled sponge or a razor, because while reaching for anything because this will help you to decrease the potential falls if you're using something long for yourself, right? If you are just shaving, so you should just sit at a toilet seat, or you should use a bathtub to sit, or a shower bench to decrease the chances of falling. And this shower or bath bench picture can be just seen if the picture which I have just shown. So this kind of a stool, a light stool which balances your body well at that time, you can use that. So coming on to getting into the bathtub or shower, when you are just doing this kind of an activity, you might be able to see a red X in this picture. You should stand with your feet on the red X pictured here, with your heels and the back, your knees touching the tub. So you might be able to see a black line. You should just sit on that edge of the tub, and then slowly and gradually you should move your body inside. While seated on the edge of the bathtub, swing your feet over the edge of the bathtub and place then inside the tub on the blue square which is in the next picture. You might be able to see that blue square. This is how you need to place your feet inside. So once your feet are inside, use your arms to lower your body, uh, to lower yourself into the bathtub. So it's like slowly and gradually you have to move at that time also. And when getting out of the bathtub, you should just do opposite of this. So what I should just say, it's better to just take shower while sitting, not to stand while doing shower, because either you follow any of the ways like placing one foot up to shave or leaning forward, that it will lead to injury or it will lead to falls. So you should avoid taking a shower while standing. So, if we come on to dressing yourself, making your hair, or doing a makeup, so what you need to prefer is you should use a handheld mirror or a mirror which sits on the countertop. That will decrease a need to lean forward to see yourself. So, it's like managing your body so that you don't have to lean much forward. So, sit down to put on makeup or comb your hair. This actually helps to stress load on your body and also decreases the need for leaning forward while standing. So it's better to just sit and do that. If you don't have any option, if you have that standing part only, you have to do makeup and you have to comb your hairs at that time, you should do one more thing. You should just keep one hand on the counter so that your body is balanced, and one foot up on a stool to so that your back is not strained much. So let's come on to some of the instrumental activities. Like obviously, you are not only going to do some self-care kind of activities, you have to be involved in some home activities also. So here I'm just talking about some of the home activities, how you should just manage and how you should come across with it. So while making your bed, right? So what you need to do is you have to raise the height of the bed. So how you can just raise the height of the bed? the blocks can be placed. The blocks should not be in the disbalanced form. It should be balanced properly. The blocks should be placed so that the height of the bed is it should be tall enough so that you don't have to bend for making the bed. So the in the picture above, you can just see a half kneeling position, which you can opt to tuck in the bedding, the bed sheet in the corners of your bed. This will help you not to strain up your back, not your legs. It will avoid the falling part and the exertion part also. The other way around you can just do is you can use once around the bed method. So this is where you have to do, the bed is made all the way towards one side and then you have to go to the other side. So this is the part what I can just say you can do. But if you are into the last trimester, your abdomen becomes very big. So then you can leave the bed. You can ask someone to help you in this. Coming on to the laundry tips. So you need to avoid lifting at this time. You should place your laundry basket on the dryer or the table when you have to unload or load your washer, right? You can use a stick, as you might be. You can just see in the picture. There is a kind of a long handled reacher which that lady is using to get taking out those wet clothes out of the top loading washer. So you can use this kind of a thing. And the other thing which I can just tell you is how you can just at that 9 months phase, what you can just do is an ideal laundry room should include side by side washer and dryer. You don't have to bend much and you don't have to twist much. So you should just balance in that way so that your laundry room is organized, because laundry room is like the thing which you have to use it very regularly, whether you are pregnant or not pregnant. But at this time, you have to just manage it well. If using a front loading washer or dryer, sit on a chair. Then because you have, in other cases, you have to bend. So it's better to just sit on a chair at that time to remove the laundry so that much reaching forward or much bending is avoided at that time. Now, the other thing is you should not like pick more than 25 pounds of the laundry basket. So it's like not only the laundry basket, you should not pick more than that basically. You can just use a wheel kind of a cart to move your laundry or anything which is like heavy to use. So you can use that kind of a thing, or you can just take several trips for this and you can just carry lighter loads at that time. And so this will basically help you to avoid the stress on your body, and it will help your baby to rest in a proper manner. Now, coming on to the cooking and the cleaning part. So, while washing the dishes or cooking, you should place one foot on the small stool in front of you, or either you can just open a cupboard in front of you. That is basically designed whenever you are designing your ergonomic kitchen, or whether it's the normal kitchen also. You have a shelf below your basins, right? So you can just open that door and you can place your one foot there. So what you need to do is you need to alternate your legs so that your body or your one leg is not strained much. So every 5 to 10 minutes you can do that. Placing one foot on a stool or cupboard, so that will decrease that curve in the back and it will ease your back pain. Now, what you have to do is when you are into kitchen, so you need to do one thing. You have to take regular sitting breaks. While you are doing some activity, you should place some chair or a stool which will balance your body up. So you should just take sitting breaks in between. And secondly, what you need to do is whatever you are just doing on your slabs, so you should just pull those things in front of you. Don't have to bend much to reach those things, right? And you should just use the four, if you are just using four burners kind of gas, so you can just use front burners to just avoid that bending or reaching to the back burners, and use a wheeled cart to move any of the items in the kitchen or home. If you have that kind of a trolley, that will help you balance your body. Now coming on to the cleaning, dusting and cleaning, so how you need to manage it. Remember to always face the object being clean. You don't have to twist the body to clean that object, right? Long handled feather dusters you might be just able to see in the market. To reach the tall surfaces, you can use that. And do not use a stool or ladder because that will increase your risk of fall. And make sure that the air ventilation is good while using that chemicals for dusting and all, because that will hamper your blood circulation or your nasal passages or ventilation part also. And hold on to a sturdy object or wall for support if necessary, if you feel necessary to lean or bend forward. Last, what I should just say is kneel down or sit to clean low objects and do not stoop or bend at the waist. So the one thing which you need to consider is if you are just cleaning at the right side, you should just use the right hand. You should not use the left hand because then your body will be twisted up. So this is like the vice versa which you should follow. Or you can ask for heavy dusting part, other person to help you in that so that you don't have to bend or take much uh, like exertion on you. Now coming on to vacuuming and sweeping. So you what you need to do is you have to keep one foot in front of the other, about like the shoulder apart, a width apart from that, and do not bend forward much to reach places. Instead, move your entire body. You don't have to bend much. It's better to to bend, not to bend much. Use your feet and legs to move the vacuum rather than pushing, pulling, and reaching with your arms. So use your feet much. Don't use your arms. Then you have to move. You have to bend much if you're using arms to push anything forward. And when vacuuming or sweeping under furniture, bend at knees at that time and squat down rather than bending and leaning forward. Just take care of that. Now coming on to work. So I think what we can just say is work is like we are not only working in offices, we are these days doing work from home also. So this is like a suggestion. I think these kind of things you must be having at your home also while working on the laptop, and how you need to sit when you are just working on a laptop, or if you are helping a kid to study, so you can just guide your kid also to just study in this way. So what are the suggestions? Choose a firm chair with armrest. Lower back should be supported properly. Footstool should be used. And having a lower back support and a footstool, that will help you to have the lower back natural curve that will be retained in that way. And you must sit for a long time and stand and move. So basically what you need to do is you need to take some breaks after every 30 to 40 minutes. And standing from a chair, you should not do the second figure which I have just shown here. You should just do the first figure, as in the red chair the lady is just getting up from the chair. You should just push up, like use your arms to push off the armrest of a chair to help you stand. The standing posture is also very important at this time. You need to distribute your weight on both the feet, and bottom should be tucked under, chin down, shoulders back, rib cage flat, and back should be there, and knees should be bent at this time. Then obviously you might be now, maybe you are moving into the car also these days, because people are not much into that hassle of COVID also. So they are moving into cars also. So you need to consider this thing right now. Getting into a car. Stand so the back of your legs are touching the car, and then you have to slowly and gradually sit on that car seat, as you might be able to see in these pictures. Next, swing your feet into the car slowly, one at a time. And sitting in the car, you have to consider one thing, that you have to fasten your seat belt under the stomach and across the hips, and slightly recline your chair 100 to 110 degrees. So you can just manage with these angles while sitting. So coming on to the monitor. So what you need to do is you have to place your monitor in front of you properly. It should not be in the right side. It should not be in the left side. So it should be positioned in the way that it should be 2 to 3 inches above your eyes, and it should be arm length away from your body, because the angles of your arm should not be that much. So it should not do that nerve compression or so. And it should be glare free also. The screen should be glare free so that your eyes are not much strained. Coming on to your keyboard placement, it should be close to you, centered, and you might be able to see into your keyboard or into your laptop. There is a B key kind of thing. So your that arms should be placed in that manner. Your keyboard should be placed in that manner, and wrist should be as flat and straight as possible at that time. And the mouse should be at a distance where your upper arm is relaxed, and it should not be overstretched or too close to your body. And angle at elbow should be greater than 90 degree to avoid pinching of the nerves. So you should just manage uh, whenever you are sitting, you have to see the desktop placement, you have to see the keyboard placement, you have to see the mouse placement. And the desk should be stable. There are sometimes the wheels and also that will be very tricky to manage at that time of pregnancy. It should be stable and it should be 28 to 30 inches above the floor. Now coming on to the other thing is like the chair, right? So what you need to do is it should be 100 to 110 degrees of recline for supporting your back, and lumbar support should be there. Changeable height of that chair should be there, because maybe you are not comfortable in one height, you need to do up and down. And one thing you need to do is you need to place your foot on the floor or on the footrest, so that that your feet that doesn't have that DVT kind of thing, that deepens proboscis after hanging your legs too much. Your body should be aligned in a proper way. Head and neck should be aligned in a good manner. Straight as possible, you don't have to bend much. And then elbows and upper arm should be at or greater than 90 degrees to stay away from your elbow compression, because elbow compression might happen if you talk about an ergonomic advice at this time. You should be relaxed as much as possible. Remember few things, that you have to give enough of the eye breaks to your eyes. Like every 15 minutes you should just take eye muscles exercises for yourself. You should blink and you should manage with your eye exercises. Secondly, you should rest in between. Every 30 to 60 minutes you should stretch, you should walk around, you should drink water, you should your hands should rest in a better way, so that everything should be well managed off. So this is a fun kind of a option which you can get while you are just working on a desktop. You should set up a program on your computer, because it's like it becomes very hectic. Maybe you will not be able to get up, or you will not be able to get into some kind of uh, like activities. So you should just put up some kind of a reminder for the stretches and the rest you should just take in between. This is one link actually which you can just note it down. So these programs basically remind you to take rest in between at that time of pregnancy, and list exercises also in that software, and that help you to stretch your body enough which is required at the time of pregnancy. Sachin, can you just play this video for me? Not this one. Not this one. Not this one. The other one. Yeah. Thank you, Sachin. Let's have the presentation back. So, if we talk about ergonomic checklist, so these are like the body areas which you need to focus whenever you are into these phases of life. You should just check wrist if it is not overstretch or understretch, the back, the neck, and the legs. So you should just make a checklist for your body. So now it's like the last topic for my presentation is the technology innovations for improving your posture, which you can definitely use in your pregnancy times to check your posture if you are bending too much. So that will help you to avoid uh, bending too much in this pregnancy. So pregnancy wrong posture stops here. Sachin, can you just play this video, the last one which you have played? Thank you, Sachin. Let's get back to presentation now. Yeah. So when I'm just talking about the strategies, this helps actually to tell you if you are into a wrong posture. So you need to basically wear, calibrate, and sit upright, walking, standing, or whatever activity you are just doing. It will help you to alert yourself. And the features which I'm just going to talk about track is it will help you to track the inactivity also. Whatever like you are, you will be able to sync your data in your mobile. So you must be able to see that in the video the lady was using a mobile. So everything can be synced through your mobile. This device is very small and it can be wearable. It is wearable anywhere, like over the clothes also and directly on the neck also. If we talk about some kind of belts also, that is very uncomfortable. They are sometimes heavy to use, but this is very light to use. It is like it is not having any constraint with any of the sizes. Any of the, like any lean or any fatty lady or any of the ones can wear this. And so it will help you to give you a bad posture reminder. It will help you with track and train. So it is like compatible with all the iOS and Android version of mobile phones. So these are some kind of an happy users who use this kind of a device for their posture problems, and they were very happy to use this device. So what I can just say is maintaining your body only is not one thing. The facilities which you are into working, like the environmental setting should be good, the temperature, the lighting, and the air quality should be good when you are doing in any of the activity. Even you are taking rest, also the environmental setting should be good. When you are working, the lighting should be good. Either the office light, either the home light should be good in any of the activities that you are performing. So if we come on to, so this is like the end of my presentation, but the last slide, I'm just talking about some of the takeaway points. Just uh, just see what all takeaway points we have. You should just assign less physical tasks. You should take lift less than 25 pounds or 25 pounds. And what do you need to do if you're an employer and you have a pregnant lady with you, or whether if you are at home also, you have your husband with you. So you should just like consider these points. You should have some adjustable work which will be managed together, or you should just take some support of a person in your office. Adjust height of workspaces and chairs, install footrest, limit standing to less than 3 hours per day. Just limit that thing, because that will strain your back. The other thing which you need to do is offer shorter and more frequent breaks in between, just to relax yourself. Reduce the amount of work performed at heights. You should not perform those height works at that time. Provide more space for moving around, and remove the obstacles in the work area, particularly those placed at the lower levels. Just remove those obstacles and promote safe lifting techniques at that time. Thank you. So this is like the talk which I just thought to deliver. Thank you, Sachin. It's over.